CBS News contributor Frank Luntz is a Republican strategist. He joins us now from Sacramento. Frank, good morning. It's good to see you. We're going to talk about the health care bill in just a second, but let's talk about Donald Trump's released tax returns. What's your take on how this is all playing out? The president has already called it fake news this morning.
Well, I thought the 2016 election was over. I was grateful for that. And it's back again. And the one conclusion I'd offer is that most Americans really don't care. This was an issue that was debated in August, September, October of last year. We're now 2 months into the new presidency, and they want to focus on the topics of the day. And they're looking back. This is 12 years ago. And the fact that it's been brought forward, I think it's just going to convince Trump people that the news media is out to get them.
But Frank, when you go to the town halls, the people there are saying, yes, we do want to hear the tax returns. That seems to be changing in terms of the viewers not wanting to know what's on the tax returns. I think that's changing a bit.
No, it actually, with all due respect, it isn't changing. Those are people, those are professional protesters. They're showing up at Republican events all across the country. Events that normally would have 200 people have 2,000. But it's not your average everyday citizens. It's people who've come to disrupt. And yes, are they raising it, Gail? They are. But it doesn't mean that the American people care. In all the polling that we have done, this isn't even a top 10 issue. It's one of the reasons why Americans are so fed up with Washington and so fed up with politics as usual. And frankly, the media has to be able to hold this president and Congress accountable. They have to have the credibility to be able to call the White House's bluff. But they can't do it if they're focused on issues average American, the ordinary American, doesn't care about.
What is the media not doing that you think they should do?
Well, they need to focus on health care, which you all are doing. But you have to also go back. And by the way, Charlie, it's great to see you again.
Thank you.
Welcome back. We've missed you.
Thank you.
They need to focus on what was happening and what is happening to Obamacare at the same time that they are focused on the details of the Republican plan. It isn't an either-or. It's not just what the GOP is doing. It's the failure of the plan right now. And Charlie, this president, the last president, said that health care costs would go down, but they're skyrocketing across the country. He claimed that you would be able to keep your care, but we know that millions of people lost it. They said that health care was going to be more simple, more easy, and it isn't. There are issues with the current Republican plan and communication failures, quite bluntly. But it isn't just what the Republicans are putting out. It is also what the Democrats have done over the last 4 years, and we need to cover all of that in the same story.
Well, Republicans are not on the same page about the GOP bill. What do you say about that?
Well, I'll give you a good example. They talk about we need to increase competition. I have yet to hear a single ordinary American say what we need is more competition. What they say is they need more choices, they want more control, they don't want anything to get in the way of their doctor-patient relationship, but they don't talk about competition. The Republican leadership in the House is focused on legislation. What they should be focused on is health and health delivery and how Americans connect to the healthcare system, their doctor, their hospital, their prescription drug benefits. And that's not what's happening. It's coming across as philosophy, as policy, rather than as a real human need.
It's been a long time in coming.
Well, when you look at it, Frank, I mean, the questions still are, how do you get a significant number of young people engaged so that they can pay the expenses that are necessary to help old people under both Medicare and Medicaid?
And so you have to personalize, you have to humanize it. You have to connect to them in a way that they see that this is good for them for the long term. Once young people get married, it changes. Once they have their first child, of course, it changes. But the question is, how do you get people between the ages of 27 and 34 involved in this? And that's not happening. It didn't happen when the Democrats ran health care. It doesn't seem to be happening now as the Republicans are putting forward their alternative. Look, this is an issue of what we need, what we want, and what we deserve. We need health care that is affordable and access to it. We want choices and the ability to genuinely choose our doctor, a hospital, a health care plan, and we deserve quality. And that is what the Republicans should be focused on. And it's not happening right now.
The interesting thing, too, is it's a long way from what President Trump promised during the campaign.
You're absolutely right. And I don't know, as someone who's watching this, and interviewing members of Congress, I don't know how it's going to resolve itself. But, Charlie, the Democrats have told me, the Democrats, not a single Senate Democrat or House Democrat plans to vote for anything that the Republicans are doing. That makes fixing, reforming, repairing, whatever words you want to use, it makes changing the healthcare system incredibly difficult if not a single member of the opposition party is participating.
All right, Frank Luntz, thank you so much.